So if an individual who is Black or Latino or Latina gets COVID, they are 3 times as likely to be hospitalized as a Caucasian individual. And they're about twice as likely to die of the disease. So I think this is a reason why it's especially pressing for individuals of color to get vaccinated. We also know that from an economic and educational perspective, while COVID has been devastating, across multiple communities, it has been particularly devastating to communities of color, where access to remote education may not be as easy, and so the loss of in-person schooling has been especially problematic. I think businesses in minority communities have been hit very hard by closures due to COVID. And we know that people of color disproportionately are frontline workers in restaurants, grocery stores, et cetera, and thus more exposed to COVID. So for all of these reasons, for health reasons, for economic reasons, for educational reasons, it is especially vital that this vaccine has uptake within communities of color.
So, thank you, doctor. So, for the elder in our community who are not tech savvy, they will not go inside the internet or like subscribe or sign up. How do you get access to the vaccine? Is it through like walk in to Reggie Lewis, or like how do you get access to the vaccine?
So there are toll-free numbers that the Massachusetts government has set up, and I think ISBCC will help disseminate those numbers. I think that's probably the easiest way to do it that doesn't involve actually using the internet. Unfortunately, most of the vaccine sites do not have walk-in at this point. So you have to sign up ahead of time, whether it's by a toll-free number or via the internet. But I do think that one of the problems with the early phase of the rollout was the excessive reliance on the internet, which I think did hinder the ability of individuals who may not have access to the internet to be able to register, or who may not be savvy with the internet. So I do think that was a problem early on in the rollout. But I think, with the toll-free numbers that are now available, hopefully that will be of help.
And I was discussing with some folks at the IBC, and I know that they are arranging something whereby they will be collecting our elderly from the community, do the sign up, and put them like in van and drive them to the vaccination sites to take the vaccine. And I think this will be very good service from the ISBC as well. Doctor, thank you very much, Mohammed. Yeah, go on.
Sorry, I said this is a wonderful opportunity that ISBCC is taking to really help the community here. I think in helping individuals sign up by providing some kind of logistical support, and with helping transportation, I think mashallah, that's wonderful for the community in need here.
Awesome. One final thing, you said that there's an announcement, breakthrough announcement for the people above 65 in Massachusetts. Can you please shed some light on that?
Yeah, so as everyone knows, the COVID vaccine is being rolled out in phases. And so phase 1 involved individuals older than 75 and healthcare workers. And now phase 2 is officially, it was just announced beginning tomorrow, individuals who are older than 65 now are eligible to get vaccinated, as well as individuals with 2 or more comorbidities. And by comorbidities, these are chronic health conditions like diabetes, heart disease, asthma. So there's a list of these diseases that are also very prevalent in our population, which if you have 2 of them and you're younger than 65, you will be eligible to get vaccinated. Or even if you have no comorbidities, if you are simply 65 or older, you will be eligible to get vaccinated. I encourage everyone to take advantage of this and sign up as soon as possible.
That's awesome. And I read that those even comorbidity you don't have to prove it. It's like a word of honor. You have the comorbid disease, so you sign for it and you go and take the vaccine. So, Mohammed, thank you very
Yes.
much for being with us tonight. Been very helpful. You shed some light on stuff that people in our community were like skeptical about. I hope after this episode, people will come to the ISBC, sign up, and you will see a big chunk of our community at Regileo's vaccination center. Thank you very much and have a good night. Thank you,
Exactly.
sir.
Thanks a lot.
Assalamu alaikum. Assalamu alaikum.
Sorry.